Now moving on to, in late June, the LGBT community held pride parades and festivals here in Minneapolis and across the country. While the LGBT community has a lot to celebrate, the individuals, LGBT individuals, still face incredible mental health challenges and addiction. To tell us about them and what help is available here in the Twin Cities, we're very pleased to have back with us Christopher Ackerman. Thank you for being with us.
Thank you for having me again, Jody.
He's the outpatient addiction counselor lead and life addiction care counselor at St. Joseph's Hospital in downtown St. Paul.
It's kind of a mouthful, isn't
It is. But what are some of those mental health challenges in addiction?
Well, unfortunately, due to some of the discrimination the LGBT community faces, some of different family dynamics and responses to finding out their child, their loved one, their family member identifies as lesbian, bisexual, gay, or transgender, people in the LGBT community experience more addiction than most heterosexual, gender-conforming populations. Lesbians in particular see more anxiety disorders, PTSD, anxiety.
PTSD.
Mm-hmm.
Wow.
A lot of PTSD. There's a lot of increased instances and experiences of trauma within the LGBT community as well.
Also, I think I had read what some of the stats you had provided me were a higher rate of suicides as well.
Absolutely. There's, particularly within gay male populations and gay men who are quote-unquote closeted, meaning that they haven't told anybody that they do identify as gay, have higher rates of depression and suicidality as far as, and also we have transgender individuals who have higher rates of depression and suicide as well.
So you work a lot with patients that have some of these addictions and depression. Mm-hmm. What is some of the work that you do with them and how does that help them?
We really focus on what we've come to find through research that the Substance Abuse Mental Health Services Administration has found to be effective with mental health and addiction are 8 dimensions of wellness, which are 8 different dimensions of people's lives, from occupational financial wellness to spiritual wellness to intellectual wellness and emotional wellness, that we help clients identify what their goals are, what would make them satisfied, what they want to overcome, what the addiction and mental health is preventing them to do, and help them come up with specific plans for them to meet those goals and those needs.
Can you give us an example of one of those 8 wellness things, and how do you address it?
So particularly this week in our program, we're talking about occupational wellness and financial wellness. So some of the things that we do where we talk about different job skills and doing budgets and figuring out how to balance checkbooks and apply for jobs, put together resumes, different kind of skills that they can get back into work and feel like they're contributing. That's what I see most of the people I work with wanting to do, is to give back and finding a job that they can feel excited about and passionate about.
And while at the top I was mentioning how there's been a lot to celebrate in the community, but yet there is still that underlying discrimination.
There is a lot of places you can still get fired for identifying as LGBT.
Wow.
You can adopt children for being identified as LGBT. You can be denied housing for being identified as LGBT in some states. There's a lot of discrimination still out there.
And there is some pending legislation nationally and statewide that I understand. So last time you were on the program, you were talking about the LIFE program.
Absolutely.
You were just starting the program. Why don't you tell us, remind us, what is LIFE program, L-I-F-E,
Yep.
and how's it going? And
it's going really well. The last time I was here in February, I think it was, we had my very first client in that program come in. And we've had a lot of people graduate since then, a lot of people find jobs. A lot of people have gotten to this place where their new problem is, I don't have this chronic anxiety anymore, I don't have this chronic depression, now what do I do? So it's kind of an interesting problem to have. And having people move on and get back into work and finding jobs and getting back into school has been amazing. So it's been going really well.
how does the program work again? It's
about a 3-month program. We start off a little bit more intensive where it's 4 days a week. And then as you come longer, it's less and less. It's 2 days a week, 1 day a week. And then we have individual sessions every week just to kind of check in. How does what we do in group translate to what you're actually doing, your specific plan?
I bet some of the clients, patients, it has to be just like, wow, where was this? I mean, I could have used this a while ago, and just so helpful.
We were having that discussion yesterday in group, actually. A couple of my people were saying, you know, if we had some place to go to talk about some of these things when we were younger, I may not have been at this point. I may not have been losing jobs. I may not have been addicted. I may have dealt with the mental health already.
And does insurance cover the program?
The insurance does cover our program. Individual and private insurances cover the program. Medicare covers the program. We're one of the very few treatment centers that do accept Medicare. There's also county funding through any county that you live in the state of Minnesota. Primarily, we work with Hennepin County, Dakota County, and Ramsey County.
So if you live in one of those counties, you can attend this program?
Absolutely. And if you don't have a job, we can help you apply for county assistance to help pay for treatment until we get you back on your feet and get you out there working and getting your own insurance.
So if someone wanted to get more information about the program or other programs, how can they go about doing that?
They can either call us over at St. Joe's at the Life program, and that phone number is 651-326-3645. Or they can actually go through a community organization that we're partnering with called the Rainbow Health Initiative. And they have access and lists of providers for physical health, mental health, addiction, all kinds of different things to help people find somebody that will understand them.
And we have just a couple of minutes left. So basically, what is the Rainbow Health Initiative? The
Rainbow Health Initiative, like I said, is just a community resource where people can go when, you know, I really need to see a doctor, I really need to see a dentist, I need to see a therapist, but I'm not sure if I'm comfortable bringing up the whole, okay, I'm gay or I'm bisexual or whatever. And these people have demonstrated, have proven that they have some sort of training, knowledge, expertise in that area, so people can address that part and get those needs met as part of their care as well.
So we're starting to see more programs available.
We are. Right now there's only 3 treatment centers specifically for LGBT-specific people in Minnesota, whereas there's over 300 treatment centers in the state of Minnesota. So we're at about 1%.
Oh, wow.
And our Life program is the first hospital-based LGBT program in the state of Minnesota, which opens up a whole range of care from hospitals to our clinics to therapists. Our Roselawn Clinic also does some hormone therapy with Dr. Jewett over at our Roselawn Clinic. So we have a huge range of resources for clients.
Final comments that you'd want to leave with our viewers about what help is available?
Help is available if you call a treatment center. Our primary goal of most treatment centers is to get the help that you need. And it's asking the questions and not being ashamed. Everything that you're going through, everything that you're experiencing, odds are multiple people have heard it before or been through it before, and that we look at it as the problem is the addiction or the mental health, not the person calling in, not the person coming into groups. It's fighting back against those things that are taking these people's lives away. So trying to look at it that way, it's not a problem with the person, it's the problems that you're experiencing and asking for help with them.
Yeah, I would think they would feel so isolated and alone, and where do I go for help? And
absolutely, and help is there, and people do recover, and people do find that happiness, and it's just giving yourself that chance to do it, taking that risk.
And if we can have you one more time, say if they want some help, where can they get that help?
They can get, again, the information from us at St. Joe's at 651-326-3645. Or at rainbowhealth.org, which is the Rainbow Health Initiative.
Well, Christopher Ackerman, it's always great to have you with us.
Absolutely. Thank you for having me.
Thank you. And we'd like to thank you for joining us. We'll hope you join us next time on Inside Healthcare. We'll see you then, everyone.